Thank you, Steve. I'm very gratified to be here. It's an honor to help get out the truth about healthcare. Steve mentioned a number of diseases such as diabetes. Only two causes of death exceed medical error in the United States: heart disease and cancer. Heart disease is a little bit more than 500,000 deaths per year. Cancer is a little bit less. Medical error is conservatively estimated at killing 250,000 people per year. There are different estimates. Probably the best study was done by NASA's chief toxicologist. It was a study of studies, and it ranged medical error at between 210 and 440,000 deaths per year. So I am not a medical malpractice attorney. You might say, well, you are an attorney. How did you get into this? And I'll tell you in a minute. I don't even think that the medical malpractice system, although I think it's beneficial in terms of compensating a few seriously injured people, I don't think it helps with the medical error problem in America. And I'll talk about that as well. So how did I get involved in this topic? Well, I've over the years, in addition to my legal career, I've written about a host of industries, mainly large industries, steel, agribusiness, corrections, law enforcement, finance, and so forth. Well, there's no industry really bigger in the United States today than healthcare. It's about 22% of the economy, about $2.7 trillion. And I got into it, I got interested in thinking about this in about 15 years ago, when my professional mentor, a very distinguished African-American civil rights attorney, a contemporary really of Thurgood Marshall, named Bird Brown, went into the hospital at the age of 70 to have a lung transplant. He was a very sick man, very ill. You don't get a transplant like that unless you are quite ill. And he survived the transplant. But afterwards, he was given 10 times the dosage that he should have gotten of an anti-rejection drug, and he died. That's called a medication error. And then I started to keep a file, as I do, about certain matters that interest me, particularly about business and industry and government. And I started to see things happen among my own friends and family, many of whom, including my father, came home from the hospital with serious hospital-acquired infections, which we call HAIs, or at least that's what the medical profession calls them. He was, it very much affected his last years before he died. If you get a bloodborne infection, you're a very sick individual. Some of you, I'm sure, have experienced that or seen it among your friends and family. My mother, in her later years, had brain surgery for a fast-growing non-malignant tumor. She survived it. Unfortunately, the team, there was no proper exchange of information between the neurosurgeon and the medical team following her. So she didn't receive an anti-seizure medication. She went into a coma. This is after she had apparently recovered relatively well from the surgery, and she was left paralyzed. She was a hemiplegic for her remaining years. In 2011, I had relatively mysterious condition myself. Suddenly on one of my feet, it became very dark, on the toes were darkened considerably, looked like gangrene, felt horrible, I couldn't walk. Normally I'm a very mobile kind of a person. So one day I went into the emergency room thinking that perhaps I had a clot. No one could diagnose this. The emergency department physician referred me to made a referral to a vascular surgeon, attending physician, who was going to come in and assess cutting my toes off. Well, I made the decision to call a very good friend, my best friend really, who is my PCP, my family physician. And he came to the hospital and he said, well, we don't know what's wrong with you, but get out of here. And I did. I left the hospital. Eventually, I got diagnosed with a platelet disorder. I have high platelets, sludgy blood, clogged up the capillaries in my toes, made walking very difficult. There's a medication for that, and I take it on a maintenance basis, and I have a normal life. If they had cut off my toes, that would have been an unnecessary medical error, like a wrong site surgery, which the profession calls a never event. It never should happen. Unfortunately, it does happen sometimes. Interestingly enough, my doctor friend sent he didn't send her, but his elderly mother went into a very fine university teaching complex, hospital system, to have relatively routine cataract surgery. But she's an elderly person, and that's a dangerous situation. You're twice as likely over the age of 65 to experience a medical error as are people younger. She had an anesthesia error, she aspirated vomit, and she died. Hospitals are, as some of you know, dangerous places. So are long-term care facilities, so are clinics. We're finding today that, and I'm going to talk about this towards the end of the talk, really the most common medical error, the one that we can't get our arms around, is diagnostic error. You can have late diagnosis, you can have non-diagnosis, you can have overdiagnosis. But in any event, that seems to be the greatest killer. The studies are somewhat preliminary, but I went to Johns Hopkins, great medical system, great hospital with a great history, and the leader of the largest study, which was printed in the British Medical Journal, a man named David Newman Toker, reflected on diagnostic error, and based on certain studies, and I'm going to get again to this at the end of the talk, says that just from diagnostic errors, these are mainly made, 2/3 of them are made in doctors' offices. There are 100,000 to 500,000 annually. We don't know how many exactly. We know they're the most common. We know from a 25-year study of something called the National Practitioners Database that appeared in the British Medical Journal, sometimes called the BMJ, that the National Practitioners Database includes all malpractice verdicts and settlements. You can't get into it basically unless you're a researcher or you have a case or you're defending a case of malpractice. But in terms of, it was the largest source of medical errors by far, and also paid out This is a 25-year longitudinal study, paid out the greatest amount, I believe something like $38 billion. It's been confirmed by local and regional postmortem or autopsy studies, which show that generally, but depending on the study, between 20 to 40% of us die with a diagnostic error. So that's something that really we're way behind on, and it requires more study, but not just more study of hospitals, which are the usual places we study in terms of medical errors, but we must study now the doctors who deal with us and the clinics where we go.